Hi everyone, today we're going to talk about completing the embedded behavior plan in ShareVision. And I've gone to the individuals tab and I've selected Henry Test Henry and I've just created a new plan. If you were going to add one, you would start here with add new behavior plan. But we're going to look at the one that I have created as a template. So we will open that up to edit so that you will get the same view when you open up a new plan. We're going to put in the residence or program location from the drop-down menu, the date of the plan being written, and then we're going to open up the clinical team and we're going to put in that the person has indicated their preferences and what helps to make them feel good, and check that box off. Although they may not verbally be directing as to what works well for them in supporting their behaviors, people generally let us know what their preferences are and when they are the most calm. This section is where the individual or the person who is the legal consent provider would sign off on the plan once it's completed and printed off. You will then fill this in for any behavioral consultants involved, if there was an outreach consultant from Waypoint or another hospital facility, psychiatrist's name, if they had occupational therapy, physio, speech, CCAC involved, the physician's name, clinical director, program director, supervisor, and then the last ethics review date. The ethics review recommendations can be accessed through the ethics review minutes, and those minutes the supervisor will have access to, or you may find them in the ShareVision policies and documents section for internal committee minutes. History. You will get this information from the profile history section in My Documents. So look through the history. If they have an essential elements plan, if they were previously in a facility, or if they were ever hospitalized, there'll be a psychosocial history, from example, Waypoint or another hospital. Fill in as much information as you can about places they've lived, whether they attended school, whether they worked, whether they did volunteer work, whether they were involved in other community activities, family involvement, and as much information as you can about what their present involvement with their family is. Here's the functional assessment. This section is intended to outline why there is a behavior plan. So the first thing you're going to do is list the target behavior. This tells you why there's a plan. So for example, this person becomes very aggressive toward the environment when anxious. Then you want to list what function the behavior serves. So what's the purpose of the behavior? Does it allow the person to escape from tasks that make them feel anxious? Does it allow them to avoid things they don't prefer or people they don't prefer? Does it help them to get attention that they need? Or is it, for instance, a release from anxiety? So those are the common terms that are used: escape, avoidance, attention, release from anxiety. So you want to have the target and then you want to have the purpose in this section. Biological means anything that is medical in either the person's history or their family history. So for instance, a history of seizure disorders by the person or their family, diabetes, if they had cerebral palsy, if the parents suffered from dementia, if there are any other physical concerns, perhaps with gait, mobility, eating, all of those would be here. If they tend to be sensitive to certain illnesses, that would all be included here. For example, frequent urinary tract infections. Psychological will list what type of intellectual disability they have. So you want to indicate whether it's a mild, moderate, severe delay, or borderline delay, and any other diagnosis. So, mental health diagnosis would include autism, bipolar, depression, etc. If they had any previous treatments, you would indicate that here, whether they were treatments in hospital, behavioral treatments, um, medication treatments, and if you can, how effective those were. In the social section, you'll talk about what they enjoy doing in the community, what kinds of people they like to interact with, whether it's groups, whether it's one on one, is it staff, friends, family, anything that's really preferred in the environment for them to be successful. The proactive plan then will deal with what works best for this person to have a successful day. So, for instance, if they prefer a predictable routine, if they prefer consistent tasks, if they need the support of visual cues, if they need extra preparation in order to complete activities, um, if the person has preferences around the type of environment, it needs to be a quiet environment. It needs to be an environment that offers lots of stimulation. Whatever it is should be indicated in the proactive plan. If there's other strategies that help the person to remain calm, and those might include taking a bath, listening to music, engaging in a video game with staff, talking to a friend on the phone, those should all be included in the proactive plan. Then you're going to attach a data sheet. A data sheet is not a series of sheets, it's a single piece of paper that summarizes the data for the past. Usually a year is a good indication. So you might have a graph that indicates month by month how many PRNs. You might have data that means you've gone through medication incident reports and you've counted each month how many aggressive episodes occurred. And in those cases, it might just be numbers, 2 in April, 4 in May, etc. Attach an ADL sheet. So generally people need consistent routines for success, and that's the same for us. Consistently going to work, waking up at the same time, going to bed at the same time, those things all help us to be healthy. So we would then attach the sheet of what the ADLs are for this specific person. The crisis plan is the next section. So the crisis plan now is part of the behavior plan, and it's this section. First off, we're going to talk about what works to help the person avoid crisis. Reassurance, for example, providing the PRN, being prepared for changes. Then we're going to talk about what the person might look like when they're distraught and in an emergency room. And this is good information for the doctor or the nursing staff. So, for instance, Henry may pace, he may throw his arms around, he might throw objects. Any medical or mental health risk factors. So, for example, if the person often becomes agitated if they have a tooth problem or an earache, those things would all be noted here. Medications previously effective. Generally, we write current medications are the most effective because those are the ones that we have the person presently on, and that's why we've put them on those medications, as the doctors determined they will work best. Now, in the event that the medications have not been working, then you can list when they last worked or just note that they haven't been effective for quite a while. Any history of self-harm, whether they've injured themselves, picking at themselves, banging their heads, those kinds of things. Any history of harm to others, whether it's intentional or not, it's important to note that there. Indications that they're settled and ready for discharge. So, for example, the person becomes quiet, they're able to sit down, might say they're sorry, might ask to go home, and who the crisis plan will be shared with. So in this case, I've written staff, psychiatrist, hospital personnel, I might also add doctor, or I might add other professionals that are involved with the person and family. And that is the embedded behavior plan. And so once you're completed, you'll click OK. And the next time you go to update the plan, you can simply open it up and alter the plan depending on what the team and the behavioral consultant has recommended.